In our recent assignment, we compared health policy between the United States and a country of our choice. We chose Brazil as our country, and this project is presented by Tory, Harlee, Wright, and Brooklyn Barnes. So Brazil is located on the east side of South America and is bordered by countries such as Argentina, Bolivia, Colombia, French Guiana, Guyana, Paraguay, Peru, Uruguay, and Venezuela. Demographics of Brazil include a total area of 8,515,770 square kilometers and a tropical climate. Population centers are mostly along the Atlantic coast in cities like Sao Paulo, Brasilia, and Rio de Janeiro. Religion in Brazil is for the majority Catholic, and the infant death rate is 17.5 deaths for every 1,000 live births. Life expectancy is set at 74 years, and the health expenditure is 8.35% of the country's GDP. The HIV and AIDS rate was 830,000 in 2016, and the major infectious diseases include bacterial diarrhea, hepatitis A, dengue fever, malaria, schistosomiasis, and Zika virus. Obesity rates are set at 22.1%, unemployment rates at 16.1%, and the government is also known as the Federal Presidential Republic. Here are some of Brazil's social determinants of health. Brazilian executives earn high salaries, while 26% of the population lives below the poverty line. To be a little more specific, 8.5% live below the extreme poverty line. For reference, that equals about 16.2 million people and is less than the equivalent of $1.30 in US dollars per person per day. 4.8 million of these people survive on no traceable income at all. This is all because the cost of living is extremely high, but minimum wage is only about $361 US dollars per month. So the Center for Public Security and Criminal Justice put out an article that ranked 50 different cities across the world with the highest murder rates. Brazil had 22 cities listed, whereas the U.S. had 4 and Mexico had only 5, which is surprising since Mexico has such a reputation for violent crime. Crime is exacerbated by corruption, economic recession, and fierce competition among drug traffickers that reside in Brazil. Values and beliefs include the idea that healthcare is a right, not a privilege. Brazil's constitution has promised free public healthcare to every citizen since 1988. However, they are aware that their healthcare system has its problems that need to be addressed. In a 2013 poll, 48% of respondents said that they thought healthcare was Brazil's biggest problem, ranking the issue well above education, corruption, violence, and unemployment. Brazilian healthcare is a government-funded system known as the Ministry of Health, or the Ministerio de Saúde. Any citizen is entitled to free healthcare at a public clinic or hospital, but there is limited accessibility and access is only available to those in large population areas. The private sector does exist, but the cost is incredibly expensive due to a high demand for private healthcare compared to the low supply. There are also non-governmental organizations such as Red Cross and the Academia Nacional de Medicina. And that is what we found on Brazilian healthcare. Thank you.